Good evening. It's always a great welcome when you get a large audience like this to something that we want to convey. And in that audience that I've been watching over the years, more and more younger and younger people are beginning to come. This is a very healthy sign. A few years ago, you used to get older people, but not connected to their families. Older grandmothers and so on were concerned. But now, this is becoming a general community issue. The issue is this. What you've heard so far today, Dr. Brian is a scientist who worked at Agriculture Canada, a laboratory scientist in this very subject. A scientist doesn't just do experiments. Before doing any experiment, the scientist reviews the literature, what other scientists have discovered, what other scientists have been saying, then makes an assessment and then goes further and if necessary to repeat and report. This is what you heard. He spent his whole career at looking at this technology with objectivity that perhaps is a good thing. Let us pursue. That was his job at agriculture, a laboratory scientist in this particular area. As he worked and worked, then he changed his mind because research in his time was not available. Research, objective research by other people. And then he found that other people's reports are saying exactly the opposite of what Monsanto was saying, or these biotech companies. Monsanto is not alone. There are others. Monsanto is the most evil company, and so therefore it's known for its aggressiveness, for the way, I'll report that in a minute, what Monsanto, his intentions were and what Monsanto has done to the world. I'm also a scientist, as reported, but my job was very different. I didn't do any research myself. I was a regulatory scientist at Health Canada, whose job was to receive information and research data, research results produced by the companies so that we at Health Canada would assess those results, and give our judgment, make a recommendation whether it is satisfactory, whether they're telling the truth, whether what the company is claiming about the goodness or effectiveness of their product, and how safe it is. Because the law in the country, which is called the Food and Drugs Act, which is a 100-year-old act, gradually evolved all the way beyond the thalidomide affair, revised in 1967. According to that law, any company, any vendor, any manufacturer that wants to sell means even give it away for free in the law. That manufacturer is a definition of distributor, vendor, whoever in the law is called a manufacturer. If any manufacturer wishes to sell any product in Canada that directly or indirectly gets into the human body, that company must do research as prescribed in the regulations under the Food and Drugs Act and prove to the Minister of Health that that product is safe and effective as their claim on the label of the product. Simple, straightforward. If the company doesn't provide the data, or refuses, or not enough, the company does not get approval for the product. If there are some concerns that the product could be approved, but some precautions, warnings, contraindications, it should not be used for older people or pregnant women or in children, then we put those conditions on that product. When it came to this technology, you heard the word substantial equivalence. In other words, company says, I have a seed, corn, it is the same as anybody else's, so therefore I don't need to test it. Although it's genetically modified, it's not only the product, but I'm also going to use something else, but that's not in contention. You've already approved Roundup somewhere else and do 2,4-D somewhere else. We don't have to talk about it. I'm only going to talk about my seed, which is genetically modified. So the government is not looking at that. That's one part of the government. And then, as you heard, they go somewhere else. They say, oh, my seed is very different. In one place, they said it's the same. In another place, they say it's very different, it's unique, I invented it, so therefore I want a patent, I want a complete control over it. And they get approval on both. Now, they didn't do any research, and the government believed them. And I'm now going to give you an example of what happened in my own hands. This concerned a very different product. It was not a crop, it was not a seed, it was not a fruit. It was a hormone that the cows produce themselves, and they produce, all of us produce this growth hormone. If the humans produce, we call it human growth hormone. If the cows produce it, we call it the bovine growth hormone. Dogs produce their own, pigs produce their own, and this hormone is produced from the brain, and it sends a message for the growth. So therefore, the body, when it's growing, or a woman is pregnant, there's more of it, or when you become adult, it becomes less, and then only minimal amounts are produced when to grow your hair, your nail, or replace some tissues of that wear and tear of the body. So very minimal amount of the growth hormone then is produced. What Monsanto's idea was, and a few other companies, that they would take the gene of the cow that produces the growth hormone, they would inject that gene into a bacteria. It's the opposite of what you heard just before, that you took the bacterial gene, you put that into the plant. Here they took the gene of the cow and then they put that in the bacteria, E. coli, and the bacteria thought it's the cow. Just like the cotton plant thinks it's now that bacteria that was producing toxin, and then the plant thinks I'm bacteria, I'm under attack, so I'm producing Bt toxin. This is the other way around. This is the bacteria now thinks, because the DNA has been put in there, gene has been put in there, the bacteria thinks I am the cow. And I need to produce this hormone, and as long as you keep on feeding me, I'll keep on, now just not when it's needed, but continuously. So the bacteria puts out this hormone as though it's making beer. And it comes out, and Monsanto and a few other companies got hold of this hormone. Instead of calling it bovine growth hormone, they called it recombinant bovine growth hormone, rBGH. So for the purposes of safety, they're saying It's the same as the cow's hormone. But they go to another office, they say, oh no, I invented it because I made it in the bacteria, so I want a patent on it. You heard, and now this is coming in application. And they got it right both ways, and the only country that allows patent on such organisms is the United States of America. That actually set the world rules many years earlier, that living organisms and their products cannot be patented. Those are the property of nature, God, if you like. You cannot patent naturally existing organisms or their products. But now, in later years, the United States said, yep, you can patent it. In one office, we'll say it's different. You go to the other office and we say it's the same. This application appeared on my desk in 1988 for the recombinant bovine growth hormone, and there was no data. My colleague recommended it's the same as the cow's hormone. We don't need to ask any questions. I said, that's not true. You have to ask questions because a scientist cannot assume anything. Because the law says the company has to do experiment to prove that their claim is right. You can't just say it's the same unless you prove it to me scientifically that it is the same. And it won't do any harm. The claim was that they will take this hormone, every 2 weeks they'll give an injection of it to the cow, and then the cow will produce more milk than normally. So that the farmer will use fewer cows and make more profit. And nobody, especially if it's milk, if milk gets approved, then who cares about the crops? This is the food, most sacred food. Milk. So I said to my colleague, I just happened to be acting chief for a day, for a couple of weeks. And I told my colleague, no, we have to ask the following questions. If it's a growth hormone, it will stimulate tissues of the whole body, including other hormonal glands. And if it does that, let's ask the company to produce or conduct an experiment in a few rats and show us that that doesn't happen. Give some injections or feed it, or do both. Find out if other hormones are stimulated or not. If there's any damage to the organs of the rat. Because the law says, if you want to sell any product, you're not going to test it in people until at the very end for clinical trials. You must test your product in 2 species of animals, one of which must be a non-rodent. The idea being that if this product is toxic, it will be caught somewhere or the other. And also, the product should be tested for the life of mice or rats so that cancer doesn't happen. Because cancer normally doesn't happen in rats until about 18 months, because the rat lives about 2 years, but after 18 months the incidence of cancer increases. But if it begins to come earlier, then we know there's some trouble. And then from there we say, if this is happening in rats, the same thing could happen in people, because people live 80 and above, so their relative age, projecting from that, we know what's going to happen, that if cancers, one would expect if you grow beyond 60 and so on, cancer, the rate increases. But if it begins to happen in children and younger age, now there's some trouble. Why is cancer increasing? Why are other diseases? Why diabetes is increasing? Why obesity is increasing? Why autism is increasing? Why Alzheimer's is increasing? All these chronic diseases which used to be rare are now increasing. If that's happening, then we have to ask questions. Did you test it? Did you not test it? And if you don't ask, then the company doesn't have to tell. So my question was, give this to rats and see what happens in the following organs. If it affects the pancreas, because I want to know, will it cause diabetes or something like that? Then we'll be able to measure increase in insulin, easy test. If it affects the thyroid, then we'll be able to measure thyroxine increase. It's related to metabolism and it's related to obesity. If you give it to female rats, we can measure the ovarian hormones, progesterone. Again, we'll know it's affecting fertility, sterility. I said these experiments should be done. He said, I agree, but why are we concerned about rBGH? It's only going to be given to the cow. Because if it doesn't appear in the milk, why should you worry about people? And evidence, because there's natural BGH and there's also the genetically modified BGH, which is coming out there as well, and you cannot distinguish between the two. There's no test. So he said, moreover, this is Monsanto's argument, that hormone is a protein hormone and it'll be digested away in the stomach, and so there's no worry, we don't need to ask any question. I said, it doesn't work like that. Again, you cannot assume. Take some rats, give the hormone by injection, and you will get antibody to it. If it's a protein, foreign protein will produce antibody. But take some other rats and feed the same material. If it gets digested, the rat won't produce any antibody. If it produces antibody, then we know that the hormone went through the intestinal tract of the animal into the blood. So these are legitimate experiments. Ask the company to do this test, these tests. So I wrote the letter, I sent that letter to the company, and the company was not Monsanto. The company was Eli Lilly. In Canada, two companies were competing because Canada to this day still does not allow patents on living organisms and their products. It licenses, so by default we treat it like patent, but there's no patent. In the United States, they passed a law that for GMOs, only one patent per company, whichever comes first. So in this case, Monsanto got the patent. Eli Lilly felt cheated. They came to Canada. They said, we have the same product, and it's different from Monsanto's because we, by one molecule or something, amino acid or whatever, and we want to test our product in Canadian cows. Anyway, the letter went to Eli Lilly, and everything went silent. Meanwhile, Monsanto's application is also sitting in Health Canada, and all of a sudden the file got locked up, both files, and nobody is allowed to look at that. We're all security cleared. The whole file was given in the special management of one of our colleagues, and they called him the file manager for that file. Years passed. From 88 we have jumped into 1997. Now the pressure is coming from all over the place, from ministers, from the Privy Council, to our bosses above, who are bringing the pressure down. Why are you guys sitting on this file for so long? 9 years have passed. Make up your mind. And meanwhile, the United States in 1993 have passed it. And people in the United States and Europe and Canada were showing concern that it appears that a factor called insulin-like growth factor is increased in the cow, and that it may be the cause of cancer. It could cause cancer. That was one. The second effect was, if the cow produces too much milk, its mammary glands get inflamed, it gets mastitis, and as a result of mastitis, people will now be using a lot more antibiotics, and that could result in more superbugs, and people could die, innocent people could die from the superbugs for which there are no antibiotics. Those were two major concerns by the public. Ordinary innocent public can ask these questions without being scientists. Many NGOs, many farm groups, everybody was screaming about this, but the governments are not changing their mind. The United States government said, all right, we'll clear it now, and we'll give it 2 years to see if this increases in the general milk supply, or if there's more increase of antibiotic use for mastitis and so on. By having announced that, while they said that, the European Union said, okay, in that case we'll put a 2-year moratorium and we'll see what the US produces. In Canada, the same question was asked, and people said, put a moratorium here too, and the Parliament, they said, or Health Canada said, we won't put a moratorium, but we won't approve it until the results are all out. It came to the same effect. So 94 passed, and the results came from the United States FDA, who didn't do the study. They turned the whole thing to Monsanto to pursue and give the results. What Monsanto did, they mixed all the milk, pooled all the milk, and they said there's no increase. They didn't take the milk from the cows that was being given it, they just pooled all the milk. And so obviously, if you don't ask a question, you're not going to get any answer. So they deliberately did that, and the US accepted that. Now the pressure is on us that why are you sitting for so long? In 1997, it just so happened that during this time, I had been complaining that how come I never receive a promotion? I've been in the department for over 20 years. Is there something wrong? Is it my science? Is it my English? Is it my French? Or is it just my color? Because there's nothing I can do about that. And so I was following that during these years, and all of a sudden I won these battles on racism in the public service, and then I forced their hand to give me promotion for 4 months to try me out. And they gave me this job in a different division for 4 months as acting chief in the division where my colleague was working, Dr. Margaret Hayden. She was looking at this same file from the cow safety point of view. She was equally concerned, and what she discovered, that when BGH was given to cows, their joints were swollen, they were dragging their udders on the floor, and their blood, and there was pus in the milk. There's all kinds of things were happening in the cows. Looking at the cows, now I'm saying, hey, this is if it's happening to the cow, then ultimately, even if nothing else happens, people will now be drinking with pus in the milk. According to the law, if you find in rice or whatever a wing of a fly or hair is considered to be associated with filth, so that whole stock is rejected. Now pus is coming in the milk, you're supposed to drink that. Actually nothing would happen if you ate the dead fly or swallowed the hair. Similarly, if the pus is sterile, nothing will happen to you, but it's just filthy. It's not food. And the cow is sick and going sicker and sicker every day. And while this is happening, Dr. Hayden and I are now together, and we exchange notes, and we're both feeling the pressure. And she was in a meeting where she's being pressured to let go. Forget the human safety, cow safety you don't worry about, just let go. And she said, I'm not going to let go, you can do that. The same way I was saying, I'm not going to let go. You guys can overrule us. And then the pressure came, nothing about rBGH. Now they're telling us, she's the file reviewer, I'm her chief, to approve other hormones, sex hormones, to increase beef production. And other products that actually we knew could cause cancer. They were saying, approve this, just don't ask questions, or things for fish. All kinds of things. Because of that pressure, 6 of us filed grievances that we are being pressured to pass drugs of questionable safety, and the pressure is coming from the Privy Council of Canada. When we filed these grievances, Health Canada won't touch them. Months passed. Nobody is looking at our grievance. And this is it. When you say Privy Council, that means the Prime Minister, the Cabinet, the clerk of the Privy Council, the whole government is bringing pressure. It is not the companies, it's our government bringing pressure on its own scientists to just sign off on things. And finally, this complaint, we filed a complaint, it went to the Labour Board, and the Labour Board hearing, it exploded. Media came, everybody's asking questions. And at that hearing, 1997, the National Farmers Union heard about it, heard about us, who were complaining outside about BGH, that it should not be approved. It'll bring bad name to milk, to their cows, to their profession, to their income, and so on. And as this was happening, they were pressuring, and they asked the Council of Canadians, other NGOs, Sierra Club, nobody was able to help. And then they went to the Senate. 5,000 letters were written to the Senate Committee on Agriculture. Nowadays it may be different, but when you receive this many petitions, each letter the politicians count as 5,000 votes. And they were just printed cards, and when they reached there, using this argument, the deputy chair of the Senate Committee on Agriculture, they said there should be an investigation. And they adopted it, and as the investigation began, they said, bring those scientists here. Let's hear from them, because they have these grievances. Bring them here. We were ordered to go before the Senate Committee. When we went before the Senate Committee, it's called invitation, but it's not an invitation, it's actually a subpoena, polite subpoena. If you refuse to go, you lose your job. But if you go and you tell the truth, then it's public, then you could be fired. So now we are in this very critical situation. Finally, when the invitation came, we said, sorry, I said, I don't want to go. I have to go, but I don't want to go until I am given guarantee that nothing will happen to me afterwards. And guarantee was given by the Deputy Minister, David Dodge. Alan Rock, the Minister, gave the same guarantee to the Senate. And before we got there, there was a document that we had produced, and I was party to it. BGH was about to be approved on Canada Day, not inside Canada, but in Geneva. Our Director General was sitting at the Codex Alimentarius meeting in Geneva, and he was about to say, we have no objection to the human safety evaluation of BGH. And while he was there, this story got in the press because we were in court. And because we were in court, the farmers got a copy of that report. And the report was that at one testy meeting inside Health Canada, the Director General was saying, pass it. And I said, George, what happened to my letter that I wrote in 1988? Did anybody respond? And nobody knew. And there was no response from Eli Lilly, only the pressure to pass. And I said, look, you can approve it, you can overrule me, but I want to know what happened to my letter. Because I will not let you assume me. Because then I'm incriminated in that, making that decision without data to say everything is all right. I did not approve the human safety aspect of it. But then I said, George, why do you want to do that? Why don't you assign this file to a couple of the people and see if there are gaps in the data, and if there are no gaps, then we will go ahead and approve it. But if there are gaps, then of course we have to ask that question again. To cut the long story short, we were ordered to, we were given the file, report, and in there we found a study done by Monsanto. It was sitting under our noses, locked up. Exactly the questions that I had asked had actually been investigated by Monsanto, and all my suspicions were right. That it produced effect in the insulin growth, like growth factor 1. It affected the thyroid. There were even lesions. We don't know what happened to, what would have happened to the ovary, because they didn't do any test in female rats. And when BGH was fed to some rats, they produced antibody. All those questions that I asked had been investigated by Monsanto, and the results were exactly as I suspected, and they were sitting under our noses in our department. Later on it would come out the same results had also been submitted to the US FDA. But the US FDA, as you heard before, they had already appointed a former vice president or lawyer of Monsanto as the head of that file, and Dr. Margaret Miller, who also worked for Monsanto, was also heading that file in at the US FDA. So you can see how these manipulative things are going on. Arguments that are going on outside are ignored. So then, ultimately, rBGH was not approved in Canada. Now the question is, People are arguing, taking sides. Oh, this peer-reviewed research and this GMOs are safe. It's not the issue of GMO alone. It's the issue of pesticides. It's the issue of patents. It's the issue of damage. It's all the collective damage that's occurring to the health of people is being ignored, and it's all due to corruption. And that's why I wrote that book. It's all documented. It's all there. I want to take 1 minute just to say, because all I've told you, you probably have heard in the press, indirectly. It's all described in my book, step by step. But why you're all here is not to be educated, because you all know. You may not know the details or technicalities that we are describing of either the science or law. But you are all here because you're totally frustrated and fed up why this is happening. And what can you do? You've taken the first step. That first step is that you've gone to your councillors, and BC is the first province in Canada where 22 municipalities have jointly passed a resolution that we don't care what Health Canada has done. We don't care what the province wants to decide. We, the people living in these municipalities, do not want GMOs grown here, cultivated here, used here, imported here, exported from here, and because it affects human health. This is a first. This movement is about to grow, and that's why we are here on this tour, just to be with you, because you want us to be here, because you paid and brought us here, and you want us to be working with you. And I congratulate you for taking that initiative as a province to show leadership to the rest of the country, and we are uncertain as this moves, other provinces, other municipalities will join you, and you will win, because there's precedents set up originally by one municipality in Quebec, Hudson, that banned the use of 2,4-D for cosmetic use on their lawns, and the case went because the municipality was sued by Dow Chemicals and Health Canada together, and Hudson won. They said it is their right not to use it. Doesn't matter what Health Canada did. So my position on that, in fact, that evolved in this province. When 10 years ago I came to tour similarly, I was alone then. That under the Canadian Charter of Rights and Freedoms, we, as the children of God, and as the citizens of Canada, have our divine right and our constitutional right to eat and feed to our families that nature makes. We don't care what Health Canada does. We don't care what the Prime Minister does. We do not want it in our food. Thank you.